Welcome to Gavin This COVID Talk Facebook Live Series number 5. We have managed to invite 3 special medical doctors, and 3 of them are all doctors. The only one is me, not a doctor. But people call me Dr. Leonard. That is about properties. Anyway, we are lucky we have 3 popular doctors to tell you most Malaysians don't know, but want to know, need to know about COVID. Now, back to here, we would like to introduce you 3 popular doctors who will give you the answers you want. Number of answer, like for example, you have been vaccinated, would you get a chance again to be infected by COVID-19? And a lot of people after vaccinations asking a lot of questions, they will all be answers. A lot of things you want to know. Yes, let's see. Let me introduce you first. The first is Dr. Khoo, the owner of iHeal Health Sdn Bhd. He's an heart specialist. Hi, Dr. Khoo, can you let our audience know rest of things? I'm not a medical doctor. Remember, a lot of terms I'm not good at. So maybe Dr. Khoo, you can brief yourself to the audience.
Hi, good evening. I'm Dr. David Khoo. I'm a heart surgeon and the founder of iHeal Health. We run a hospital called iHeal Medical Center in Mid Valley. And right now, we are running 2 vaccination sites, one at the hospital itself, iHeal Medical Center in Mid Valley, and the other is at Setia City Convention Center, where we help man a mass vaccination site. So basically, we are involved in helping government to help achieve herd immunity by providing the vaccination.
Yes, yeah, Dr. Khoo did doing this vaccination right now. Later on, we'll come back as from whatever you want to know about, either you have been vaccinated or not. Some of this you need to know before and after anyway. And the second VIP list we have, our special guest today is Dr. Tan Kong Yong. He's a co-founder and a partner of Brighton's Healthcare. And he has a degree in medicine, surgery, and biochemistry. Dr. Tan, would you like to say hello to our audience and maybe introduce yourself a little bit extra?
Hello, good evening, everyone. I'm Dr. Tan Kong Yong. I'm one of the founders of Brighton Healthcare. We are based at Cyberjaya, and I've got a degree in medicine as well as a fellowship in surgery. In fact, I'm an eye doctor, as well as a master's in molecular biology. We are also planning to establish a vaccination center at Brighton Healthcare Cyberjaya, in which we recently got approval to proceed. And hopefully within the next 2 weeks, we will also be lending our efforts and hands to the nation in this vaccination program.
Thank you, Dr. Tan. Number 3, and the only ladies here we have is Dr. Marilyn Gayatri. She was awarded MBBS and pursued her postgraduate study as an internal medicine specialist and earned a master's degree in aging and gerontology. Doctor, would you like to say hello to our audience?
Sure. Hello, everyone. I'm Dr. Marilyn. I'm a general physician here in Brighton Healthcare. My specialty is, of course, seeing patients with diabetes, hypertension, lung disease, strokes. But my special interest is in aging studies and, of course, chronic disease prevention. In this case, it will be COVID prevention. So thank you again, Dr. Sri, for the invitation. I believe this is always a good platform to raise awareness and education about this current situation that we are in. Thanks.
Thank you, doctors. Thank you, all 3 doctors. Of course, we are going in now. Right now, we are getting into today's discussion. Wake up, Malaysian. Hear COVID from our 3 special doctors. Now, let's start taking a look at update the COVID. The things, I suppose things are getting worse. I think on the slide, they will show you for the past few months, comparing to the past 16 months, things are changing quite bad. And most of us, almost like that, got no feeling about what is happening. A lot of people already get used to it, I suppose, get used to it. Now, let's invite Dr. Marilyn to talk about comparing 2020 to 2021. does it make Malaysian worry? Let's look at the slide and let's Dr. Marilyn to explain on that. Doctor, please.
Sure. Yeah, so I think when we compare 2020 to 2021, as what Dr. Sri mentioned, when we're so used to seeing the daily numbers, really, it doesn't really hit us. But when we put it in a graph, in the graph form as this way, then we can see the surge is actually quite significant. Let me just do a very quick comparison. In the whole year of 2020, we achieved 100,000 cases, okay? But in 2021, it just took us 22 days in May to achieve the same amount that it took us one whole year. So just by that fact alone, I think it shows that the graph that we're talking about is no longer a linear graph. It's going more and more exponential. In fact, this is what our DG had termed a vertical upsurge, meaning cases going straight up like a rocket. And so that's what you see with the graph on the left. And I think all of us can remember 29th of May last month. That is one of the groundbreaking days in our Malaysian COVID history. We registered about 9,000 cases that day. Subsequently, numbers have started to come down, but I think it also comes with knowledge that we are also increasing our testing. So on that particular day, we tested 100,000 tests and we got 9,000 positive. Now our testing have reduced slightly to about 50, 60,000, and therefore we are getting about 5,000 cases. So just a word of caution, not to just look at absolute numbers, but to look at how much we are testing and how much is positive out of all the cases that we are testing. So positive rate should be 5% and below, but unfortunately right now, Malaysian, we're doing about 8%. So all these numbers simply just mean that the situation is still critical, is still very serious, and at 9,000 a day, we should still have that fear in us every day. The moment you step out of the house, you should be very aware of those numbers. Now, what is the effects of these numbers on us? Maybe if we can go to the next slide, I can explain a little bit more about how things have changed from 2020 to 2021. So immediately we see in 2020, when someone had COVID-19, it was treated like a VIP, right? You have ambulance coming to the house and, 6 or 7 staff in full PPE will be escorting you into a hospital, into isolation, especially in the hospital Sungai Buloh. But in 2021, unfortunately, that's no longer the case. We find that even if you're positive, you'd be lucky if you can get through to the phone lines to inform that you're positive and, to get the ban and to get triage. So really our healthcare system is quite overwhelmed, especially in the ICUs. Now also in 2020, we were only dealing with the original Wuhan virus, the SARS-CoV-2 virus. But in 2021, I think we don't hear the word Wuhan anymore, but all we hear is the word variants. So there's now the UK variant, the South African variant, and most recently, the most deadly still, the Indian variant. So this is how the virus has changed in the last 1 year. It's upgraded many, many times. And each time it upgrades, it creates more havoc. Now, in terms of who it affects, so in last year, we used to hear that the target group was usually in the 60s, 70s, or 80s. But now we see even younger individuals in their 20s and 30s, or even children are getting affected as numbers increase. And more importantly, previously we used to see the course of the disease over 4 to 5 days. So initially you will have a cough, fever, flu, and then the pneumonia, and then only we present with difficulty in breathing. So all together, it takes about 4 or 5 days for you to, get into the full COVID symptoms. But now you can even present at clinical stage 4 and 5. And what do I mean is this: I've heard of patients tell me that they wake up fine in the morning. By afternoon, they have a fever, a sore throat. And by night, they are already having difficulty in breathing and they're admitted to the ICU, all within 24 hours duration. So that is how the variants have come and made the disease so much more serious comparatively from 2020 to 2021. So I think these are the 4 or 5 main points that I can bring out onto how things have changed for the worse.
Okay, great. I'm not sure Dr. Tan and Dr. Koo have any kind of opinions on the changes from 2020 to 2021, or even back to the earliest date until today. Can you tell the differences or in terms of the virus, or in terms of our peoples, or in terms of the whole medical kind of facilities? Any difference? Can y'all, maybe any of you can break first?
I just want to touch a bit, maybe perhaps the molecular side, why these the strains tends to mutate. As long as the viruses are not well controlled, the viruses are proliferating at a very rapid phase. And during this proliferation, it's only natural for the virus to want to survive. And in order to survive, they at some point in time, so one of the viruses begins to mutate. And when it starts to mutate, it becomes more aggressive in terms of transmission and becomes more deadly. That's the way of the nature works. It's a survival of the fittest. So mutation is always a bad news. Unless we get this virus well controlled, I won't be surprised to see further mutations. So in future, I think without the controlling of this virus, we will see further mutations taking place in regards to this virus, and will make it more difficult to control.
Dr. Koo, Dr. David Koo, anything to share with us?
For me, my perspective, if you compare 2020 to 2021, it's not just a number that is increasing, at an alarming rate. But truly, if we look at the early part of the COVID pandemic, we see only certain parts of the country where they really exhibit good numbers. But now, across the whole peninsula, as well as East Malaysia, the numbers have certainly increased. This shows that it's not just the incidents, but also how widespread it has become, which means that traveling has always been one way where the virus spread from being in one patient to the other. But it really means the importance for us to understand the meaning of movement control. So therefore, I see this as something that is alarming, and people should be aware that truly movement control is for the reason of controlling this spread of the pandemic.
All right, thank you, doctors. Now, the second thing we want to talk about is since it has gone through, I think, almost 16 months or more longer. Now, what are we expect? Do we expect when it will be at the peak? So we want to know, when can we go out without a mask? That seems like everybody's dreams. When can we go out without a mask? Maybe Dr. Tan, do you have any idea when you talk, number one, when is it going to be the peak? Number two, when can we remove our mask?
Well, certainly one would hope to see we've just passed the peak, which is 9,000. But whether or not the cases will pick up again and move upward depends on many different factors. It depends on the virus itself, whether we will import any potential more virulent strain like the Indian variants, or the one that Dr. Melis described, now is known as the Delta strain, and whether there is social distancing is being well implemented, and most importantly, whether the populations are being vaccinated so that we can achieve the herd immunity. And if we can control all these factors, I do certainly hope to see that we have just passed the peak and cases are beginning to move down in the future.
So Dr. Tan said that the peak is over. So about Dr. Koo, what do you think? Is it really, or they won't hit 10,000 as what some of the I think some of the seafood forecast or predict we will hit 10,000 per day. Would it be happen or already past the peak?
I think peak or not is a relative matter. And surely, like Dr. Marilyn did say, when we cannot look at the absolute number itself, I think right now the positivity rate is still high. You're more than 5%. And therefore, we are certainly not talking about even stopping the movement control. So I think if you ask me, yes, there's some sign of flattening. But truly, if we were to look at the real numbers, we have to really see what is the number of tests that's being conducted. If we were to use percentage, obviously we are not exactly coming down yet. So we have to look at these numbers and treat it with caution and just stay vigilant. I think that's the whole idea about managing this pandemic.
All right, I have a slide from Dr. Marilyn. I'll put it on the screen, and then we would like to invite Dr. Marilyn to explain on possible when will they hit the peak. I look at this screen. This screen is like 70% of population being vaccinated. There will be the time the peak is over. Am I right to say that?
Okay, so I think this was the mindset that we had probably up to about 1 or 2 weeks ago. The term herd immunity. I don't know if when we have vaccinated about 70% of the population, then we feel that we will have more control over the virus. But in this last 1-2 weeks or so, even from the US, even Dr. Anthony Fauci, the medical advisor to the White House, has already mentioned that this herd immunity may come, may go, and the virus may still be with us. So I want to introduce you to something called endemic. Now we use the word pandemic, Pandemic. But soon we realize that this COVID virus will be here to stay, and it will, the term is called endemic, like Endemic, meaning to say it's still there at a very controlled rate. But if we get enough cases vaccinated, we will overpower the virus. So I think none of us will dare say, have we come to the peak or not? Is there more to come? But more to know that the virus is probably here to stay.
But even we're talking about the peak is one thing.
Yes.
Making people worry is the death rate is rising. I think I'm looking at the rate of past whole 12 months and the last few months is scary. It looks like during the last 3 months, there are a lot of, the rate is like per hour, maybe 4% leaving Earth because of COVID. Dr. Marilyn, can you also elaborate a little bit on the death rate? Why is it going up so fast and so high? I also put up the screen. I think there's a few slides from you. To explain on this.
Yeah, sure. So as we see cases are going up, and as cases go up, the more people falling sick, and the more the healthcare is overwhelmed, the more we are unable to treat, to cure. So death rates are going up, and it actually peaked at about 100 plus over about a week or two ago. And now it's stabilized at about 70, 80 a day. I can only put this down to the variants. So as we mentioned earlier, as Dr. Tan said, as we get more variants, the virus mutates. So it gains more superpowers, as we call it. Number one is the original virus. If you had it, it will infect one person. But now if you have a variant, the potential to spread to almost 30 people over a 72-hour period. So the spread rate is much faster. Number two, the disease severity is also much faster. So because of the onset of these variants, we find that the death rates are increasing as well in Malaysia. Seems like a linear curve, but if I can mention the death rates, I think it took us about a year to get 500 deaths last year. But now in a matter of 6-7 days, we are getting 500 deaths. So again, if you put it head-to-head comparison last year to this year, the cases are definitely worsening. So the variance has probably got a lot to play in this,
Right. So would you be able to explain this table against this slide?
Okay, so perhaps as I mentioned, those who have been, we have usually see that COVID affects those who are with chronic disease, but lately we are also seeing the deaths in the 30 to 60 years old group. So meaning to say, if it's a variant, it doesn't just attack people who are with poorer immunity, but people with presumably normal immune system will also succumb to the disease. And not only those with chronic disease, but even a fit and healthy person may succumb. So we are seeing more and more severe cases. And now there's also a new term called BID, meaning brought in dead. So these are clearly cases that are unable to reach a healthcare facility in time, unfortunately have succumbed to the case, yeah.
Maybe Dr. Koo can tell us any other reason why it caused the death rate is rising so fast, especially during the last 2 weeks.
No, I haven't done a tally, but I think if you look at the numbers of deaths per day, certainly it has come up. But we also must bear in mind that the number of cases also have increased. So in reality, is the mortality rate, I mean, to be fair, I haven't gone through to calculate it and compare, but the mortality rate is probably about the same. But it's just that there are more cases being now seen. Naturally, the numbers of deaths will increase. So I think we have to take in that context as well. But certainly, as Dr. Marilyn did say, if the healthcare facility is overwhelmed, naturally, if the patients are incoming at stages 4 and 5, needing to be ventilated, there'll be less opportunities for them to get the ventilation early. And that itself will, of course, increase the risk of person dying from COVID. So I think it's a good thing if we could just go back and look at the numbers of death per the number of cases for that period to see whether indeed is the mortality rate higher than before. I think it probably didn't differ very much, but it's just that there are more cases that we are seeing now. So therefore, we see more deaths per day.
I suppose there's a reason. I look at the Taiwan cases. The infected rate is not that high, like 500, 600, but the death rate is like 20, 30 or something quite high. Dr. Tan, you have any ideas, even overseas or any other countries, comparing the Malaysians' death rate? Are we at the high side or are we in control?
I can't possibly comment on the Taiwanese rate, but it does seem that the death rate there is higher in terms of proportion to number of COVID cases. I just want to say a few comments here. The death rate, what we are seeing, like for example, today's death rate is a reflection of the COVID cases of what happens around 2 weeks ago, or perhaps 3 weeks ago. We don't know. There is a lag phase. There's a lag phase between getting COVID and dying from it. So it doesn't reflect the actual number of cases we have currently. If you go according to, if you were to believe the government's figure that the fact that a number of cases actually is going down, and then you ask why isn't the death rate going down? It's because the death rate reflects what happens maybe 2 weeks, which is pretty high number of COVID cases. Second thing is that if I'm not wrong, the government did say that the total number of ICU beds in Malaysia is just over 900 beds, if I'm not wrong. And currently we have about 800, almost 900 patients in ICU. So imagine if we were to have more patients tipping over to the ICU side that requires ICU bed, there won't be enough ICU beds around the country. So any further increase in the number of patients requiring the ICU beds will not be able to manage in an ideal situation, in which case their mortality will probably goes up exponentially.
All right, great. We have numbers of audience. Well, most of them, Benny, Michael Yo, telling us they are very informative. Congratulations, and then say hello to all the doctors. There's Roger mentioned about, can my first and second doses be different? Mixed means like AZ, and then the first dose is Pfizer, and second dose. Any of you, any doctor can answer. Would you recommend they have a different brand, so-called doses for 2 doses?
Okay, I can try to attempt that. This is what we call the mix and match vaccination. I think our Minister Khairi already introduced this concept sometime this week. The main reason why we would mix dose is if you have an very severe allergic reaction to your first dose. So namely, if you took your first vaccine and you have a very, very bad skin rash or difficulty in breathing, and you cannot proceed to the second dose of a similar brand of vaccine, then only under those circumstances, I think for now, it will be considered a different type of second vaccine. But otherwise, for now, in the national rollout plan, it is still the same vaccine, just about 3 weeks apart or up to 3 months apart, depending on what type.
All right. Okay, that answers your question, I hope, Rogers. And any of you have any question, please just leave a message to us. Now, let's go and move on to the next questions. Now, when we talk about cases, I want to ask Dr. Koo, I have members who call a case that they have so-called recovered from the centers, back to home, normal life, and 3 days later, it's just like a sudden death. The heartbeat just stopped. And I want to know what anything to do with the heart when you talk about COVID. What is the relationship, or what is the cause? Is it a cause to it, or can Dr. Koo explain to us on that?
In the context of COVID infection, we have to bear in mind that it affects the patients in different ways. First of all, we know that it being a viral infection, and what happens really post-infection really depends on the immune response that one has against it. Now, we know by and large that in the case of COVID infection, the cytokine response, where it has the ability to incite our immune response to react in more serious way than it should. And really, the part that causes harm in this context, that's death in the patient, is really the damage it does to the cardiorespiratory system. And after that, when a person is heavily infected with COVID, then the secondary bacterial infection happens. This is how a person dies from COVID in the ICU itself. But in most cases, however, a lot of patients have their own immune response that can mount an attack against this virus to therefore eliminate this viral population from the body. And in that way, the person does not suffer serious consequences immediately from it. But however, we also found that in COVID itself, even after the patient is discharged, right now the medical science doesn't know enough to know whether this infection has any long effect. That's why the term long COVID came in. Because there have been cases where people continue to suffer symptoms of it. Now, then you might ask the question, how do we determine whether the patient is safe to go home or not? So this is where we look at the risk of dying from COVID. We found that those who are older and those who have comorbid conditions like obesity, high blood pressure, diabetes, or heart disease are at higher risk of dying from COVID. So therefore, we have to see the context of this patient, whether this patient has any comorbidities, whether the patient has existing heart disease or not, and to whether be clear that the death is directly due to COVID, or is it due to the existing disease that the person has. But certainly, when a person is discharged from the hospital, it is deemed that the person is no longer a threat of causing further infection. At the same time, perhaps not having risk of sudden death at home. But all must be taken in consideration of the current medical condition the person has. So we can't really say that it's due to COVID. It's possible, but it's also possible to be due to perhaps even a heart attack in a persisting heart condition.
In the recent report, doctors, a lot of cases they talk about lack of oxygen. Many of them from my past Facebook Live, they purchased this one and they look at the reading. Understand you have to be 95 and above to be so-called healthy, right? And oh no, I got 97. And many times I have is 95 and below in the past few weeks. Would this reading, would I in the risk of, I don't know, it's not COVID about, but when you're infected by COVID, if they are all worried about lack of oxygen or lower, would you explain anything about this this thing? I bought everything what I have to protect or to save, to rescue or so-called to save our life. But many of them ask me this question about this medical device and all these things. Can Dr. Koo also mention a little bit about this?
Yeah. Now this device is called a pulse oximeter. Now what it does, it measures the oxygen saturation in your blood. So this device emits a certain light that goes through the nail bed and then reflects in the capillary. So that itself send back a response and then calculate it in the device to tell you the percentage of oxygen in your blood. So normal being 95% and above. Normally in the healthy people, you're looking at even 98, 99%. So what happens in COVID is when you are infected with COVID, yeah, and when you get a pneumonia from it, meaning the COVID goes into the lungs and the oxygen exchange in the lungs is affected. So therefore, the oxygen content in the blood comes down. And when the content comes down, the saturation drops. So you use it more of a monitor rather than a diagnosis. Because there are also many other conditions that causes this oxygen saturation to drop. For example, if the person is a chronic smoker and the person's lungs are not healthy, he may not have COVID, but the oxygen saturation may hovers around maybe 92, 93%, and the person is quite well because they have adapted to it. On the other hand, a person may also have heart failure. During this time, the heart is not able to pump enough blood into the lungs for it to gather up oxygen. So as a result, the oxygen saturation can also drop even into the 80s or so. So on its own, it just indicates what is the level of oxygen level in the blood. It doesn't tell us that it's COVID. It can be due to many other conditions. But however, if we know that person has COVID, and for today, if the saturation is say 96, and over the next few hours, it gradually drops to even as low or high 80s, then you know it's time for the person to actually be seen in the hospital. So therefore, it's good as a monitoring meter to see whether you are responding or you are deteriorating from this COVID infection.
All right, guys, we are coming up. We will talk a lot about vaccination. Next, we would like to see, right? We want to know how effective the vaccination can stop the pandemic. Maybe Dr. Ten can tell us, many of them think vaccination is a long-term exercise. Many of them believe that being vaccinated can take out the mask, like the Western, they can go out on the street and walk around. They 100% think safe by having vaccination. But how effective is this vaccination can save us from this epidemic? Maybe Dr. Dan can brief us a little bit.
I think vaccination certainly plays a very crucial role in this control of this pandemic. However, even for patients who are vaccinated, it doesn't guarantee that you won't get the virus. So you'll still be able to catch the virus, although the chances of you catching the virus is much, much lower. Also, once you're vaccinated, the chances of you passing the virus to someone else, to your loved ones, is also much lower. But more critically, if you were to catch this virus, you're less likely to end up with severe complications or ended up in ICU or death. So that is the reason why we are trying to get people vaccinated in order to control this virus. Whether or not the vaccination will be able to get rid of the mask in the future is yet remain to be seen. My feeling is that even after the pandemic is well controlled, people are so used to wearing masks, you're probably going to see some people going to wear a mask to various places, to restaurants, to supermarket as well. So there will be a group of people who feel more secure behind the mask than without one. So you will not see the end of wearing masks, but certainly once the pandemic is better controlled and when the society is becoming more liberated, you'll see less people wearing masks on the street.
Yeah, based on what I understand from Dr. Ten, Dr. Marilyn, can I know that I think he mentioned about even you are being you've been vaccinated, you can be still a possible a virus carrier, COVID virus carrier. Is it right?
So what it means is that even if you're vaccinated, there is a chance that you can get the virus again and potentially pass it on, but not as severe as if you were not vaccinated. Yeah. So at this point, maybe I tell you a story. Like you say, it's easy to explain if you have a story. Right. Okay. So real life story happened in Singapore. Tan Tock Seng Hospital. So Tan Tock Seng is a hospital in Singapore. There was a nurse there who was vaccinated. She completed both her doses of vaccination. And 2 months later, she actually got infected with COVID. So immediately they did contact tracing because she worked in a ward. And so there are patients, there are visitors. They had to cordon everyone. And 40 people tested positive from this one nurse. Okay. But out of these 40 people, about 9 of them were fully vaccinated, including this nurse. So these 9 patients were completely well. They just quarantined at home, and after 2 weeks, they came out well and healthy. But the remaining 30 who were not vaccinated, I think 6 or 7 needed to be admitted to hospital, 2 to 3 end up in ICU, and 1 of them actually passed away. So now you see the clear definition of being vaccinated and not, in being reinfected with the virus. So being reinfected is very real, but the cause of the disease is very, very different, and you will take a much lower and much lesser cost if you're vaccinated. So
okay, I have a slide here for Dr. Marilyn to explain how effective is this so-called vaccination.
Sure.
Maybe, yeah, doctor can explain to us on.
Okay, yeah. So this is a slide I put up to explain what herd immunity means. Basically, if you vaccinate more people, we win, not the virus. Basically, the whole COVID saga now is between a race, okay? It's a race between the COVID virus and a race between vaccination rates. So in certain countries, we find that like in the US and in the UK, they've already reached about 47%, almost 50% of their population is vaccinated. And therefore, they can start discussing, contemplating taking out masks in meetings or restaurants. But in Malaysia, currently, our vaccination rate is, those who finish double dose, is about 5%. So we're very, very far away still from this 70% herd immunity numbers. But the more people we vaccinate, the more we can control the virus instead of the virus controlling us in this way now. Right, this is another slide that shows to date. As of today, actually 6 million people have been vaccinated. So that's quite a good number, but we are looking to vaccinate up to 10% by middle of next month. So as you can see, it will take us the whole of this year and even next to achieve the 70% rate that we are eyeing for.
But doctor, what do you expect? How soon we can reach 70%? That means that because the Prime Minister have given us stage 1, 2, 3, 4, everybody is hoping that they can cross the state or even borders open.
Correct. Yeah.
Do you think very soon we can reach 70%? Is it a 70 or now I think it raised to 80%, right?
Yes, between 70 to 80. So Minister Khairi said by next month we'll reach 10%. So I think we can calculate accordingly and see. Still quite far away, yeah.
Dr. Khoo, do you think will be a shortage of vaccines? It seems like I've seen it in Taiwan and many other countries. They are so hungry on these vaccines, but in Malaysia, would it be the case?
I think the challenge we have with vaccination is that it's a global need, and there's only so many doses that can be made at any one time, and because of that situation, so that's why WHO tried to have some form of vaccine equality, by having the COVAX program. But by and large, it is still countries that are able to pay that was going to be able to command, a better return, and get a higher number of doses. By and large, I just want to highlight and take on this. I think is an important part for the public to remember. That vaccination itself, yes, is a way out towards coming out from the pandemic. But it's not a miracle medicine that once you take it, you're not going to get COVID. It does reduce your chance of getting infected. If you do get infected, you do get it in the less severe form. And one analogy I like to say here is like if you own a house and you've been robbed one time by a small time thief, the next time you do is you then put up more defense. You install the grill, you put alarm, so that if there is a same thief coming in, it's going to be much harder to infiltrate into your house. So similarly, the role of vaccination is like that. It is to introduce our body to that possible foreign enemy, so that if it does come again, we recognize that enemy and we are better able to fight it. But doesn't mean they will not come and harm you again. So we still have to practice all the necessary known maneuvers, which is, so physical distancing, avoid necessary crowding, and of course, regular hand washing, and also mask wearing to reduce that thing from happening to you. I think this is a point that we all doctors probably all will agree on. That vaccination is a way out, but it doesn't take away that necessity of us to comply with the necessary steps that we must do to prevent this infection from happening.
All right, thank you, doctor. We have audience that Lim Fong mentioned about the vaccine protect you against the new variants. Yes, ask everybody to make sure vaccinated. And then we have Rogers talking about will Malaysian 2 vaccines currently under development become a reality? Well, we answer this later on. Of course, matching same mask will become part of life to support Dr. Tan's what you mentioned. Now, Chia Chi Wings, they asked this question. She asked these questions. Why some vaccine second doses is within 21 days from the first dosage, like Pfizer, and then 12 weeks from AZ. And then Johnson & Johnson as well is only 1 dose. Maybe Dr. Tan, would you have why all these are different, and especially the second dose is the time frame is different? Any particular reasons?
Yeah, I mean, in general, what we see is that the 2 types of vaccine. One is the virus that are being killed, viruses, and second ones are so-called the messenger RNA viruses. So in general, the one with messenger RNA virus tends to be a little bit more potent than the Q viruses. So the mRNA viruses tends to have a longer term time period between the first and the second vaccine. And also it down to the way the clinical trials are conducted by the pharmaceutical company. If the pharmaceutical company conducts a trial based on that particular time frame, which they think will offer the best immunity, then it will stick with that. They have to stick with that particular time frame. So they don't have much maneuver rooms to move away from what they originally set to study on. So if the trial is based on, say, 1 month interval between the 2 vaccines, so when they market this product, it has to stick with 1 month. In general, you see those mRNA vaccines tends to have a longer interval between the first and the second dose compared to the traditional vaccines.
Right, Bernard, you mentioned about Sinovac is also 3 weeks interval. Yes, I just had my Sinovac from KLCC 3 days ago, and I will schedule another 3 weeks later to have my second dose. Yes, 3 weeks exactly. My Chia, thank you for watching. Now, Roger asking this question. See, any of you want to answer these questions? Can we trust the exact vaccines made in Thailand, especially when the manufacturer does not have any experience making vaccine? Why is Malaysia importing from Thailand? I don't know, is it the correct remark or not? Any doctors want to answer these questions?
Well, maybe we can put it this way. After you have been vaccinated, there is a way to check if your vaccination has been successful. So I'll let Dr. Tan explain that part, the thing about the neutralizing antibody rates, right?
Right.
Yeah. Yes, I mean, there is a test nowadays you can do to see how well you are vaccinated, how well your vaccine works. And typically they are conducted at least 3 weeks after you had your second dose. Mm-hmm. It's called the neutralizing antibody test. So what happens when you're vaccinated? When you're vaccinated, your body produces antibodies. And the function of the antibody is to prevent the virus from being latched on to the cell surface using their spike protein. So the antibodies is to prevent the virus from being stick onto the cell wall. So that's why it's called the neutralizing antibodies. So the degree at which the neutralizing antibodies are able to prevent the virus from sticking onto the wall determines how well you are protected. So the higher the figure, the percentage, the higher you are protected against the COVID-19. So there is a test now to show how well your immunity is, how well your body immune response is against the COVID, because everyone reacts differently to the vaccine. So we know that the older you are, the reaction, your body immune reaction tends to be lower compared to younger patients. So by doing this test, it is an indicator. So far, there's no strong evidence to suggest that the neutralizing antibodies does prevent the COVID virus, but it does give you an indication as to whether you are at a higher risk or lower risk.
All right, thanks, Dr. Tan. Before your vaccination scheduled or before you go for your vaccines, what is the crucial question? Many people will ask, how do they get your body immune first, or getting improved? Any of you can answer this question? What to get ready yourself before the vaccination?
Zero.
Zero?
Absolutely nothing. You just need to go and get it done. Yes. And get it done as soon as possible. That's what's more important. Yeah.
Most of us, so-called laymen, before they go for vaccination, they are so worried. Should I drink warm water? Should I get this good sleep? Or a lot of questions. Friends of mine asking me also the same questions.
Yeah, unfortunately, we don't need anything more from your side except your MySejahtera app.
But yes. Canadian Duran, did you hear the latest story about Duran?
Oh, I see. No, do you want to tell me what is it?
Oh, they said somebody died because of having Duran before or after vaccinated, I think.
Yeah,
is it true?
Yeah, I'm came out and say that was a fake news, right?
I'm not sure. But there's nothing much to worry. Just prepare yourself. Just to go for it early as possible. Yes. All right. All right. The next question is, how do you know if the vaccine is effective? I think this one we can get Dr. Marilyn to talk about, and there's also a slide to, I think, yeah. How do you know if the vaccine is effective? Yes.
Yeah. So I think this is the question that Dr. Tan already answered, but you can post the slide. Basically, there's a new blood test that's out now that we can, we will take your blood from your peripheral vein and send it for testing to test exactly for this antibody. So it's called the neutralizing antibodies. And based on these levels, then maybe we can judge and see if the vaccination was, first of all, effective and how did you respond to it. So if just for your own curiosity purpose, if you want to know how have you responded to the vaccine, then this is a blood test that is an option, but it's completely something that you can do on your own, and it's not sanctioned by the Ministry of Health. It's just out of your own curiosity, yes.
All right. Okay. Okay, but I want to know, many of them ask, the vaccine effective against the new Delta or those viruses?
Variants, yes.
Yeah. Would it be
absolutely,
effective?
Yes, absolutely. Yes. So I've looked at the working paper for the Tradox virus, the AZ, the AstraZeneca vaccine, also the BioNTech vaccine. I'm yet to look at the Sinovac one, but all three have already stated very, very clearly against the variants effectiveness up to 92%. So across the board, I think all vaccines have performed head-to-head so far. Yes.
Okay, many of them ask on different types. I've seen this a few questions asking here. Okay, which vaccine is the best for you? That's your answer, is that right?
Yes, yes.
Get it early as possible now.
Correct.
Okay, then we talk about the next one. People ask you on
the types, yes.
Oh, the types, yeah.
Okay. So as of right now, I think in Malaysia, availability is these three main types of vaccines. As you can see, the mode of delivery, the vaccine in the body. First is mRNA under Pfizer, viral vector, and inactivated virus. And then the countries of origin. But I want to draw your attention to the word efficacy. So when you see there, finally, efficacy is about 95% for Pfizer. Even AstraZeneca goes up to 90%, and Sinovac goes up to 90%. So what's more important at the end of the day, the end product of all vaccination, what we want is the efficacy. It needs to be able to fight against the virus, and all three have been tested and sanctioned by the WHO to be used in Malaysia and has proven its effectiveness. Now, right at the bottom, you can also see the countries in which all these vaccines have been used. And so understandably, Pfizer, Astra, more towards the Western population, but for Asian population, Sinovac has been well established as well. So there's no questions actually to know, except just for your own knowledge and curiosity. Because at the end of the day, when we look at vaccination, our main goal is still to vaccinate everyone as soon as possible. And it's not a question of an individual vaccine, what do you get? What does it do to you? We must cross out the words I, me, you, but start talking about as a country, as a population, or even globally. So that's probably the bigger question that needs to be answered. Now, how fast can we get everybody vaccinated? Yeah.
Okay, there are a lot of questions just came in. Okay. All right, Julian, yes, the vaccine safe for a long time. I don't think so, right? Okay, when you're being vaccinated, how after 2 doses or 3, would it last for 5 years or long term? Any ideas, Dr. Koo or Dr. Ten? Any idea how long would it last? So-called, yeah.
Now, generally, we know that upon completion of the 2 doses, we are looking at a possibility of needing another booster dose after about a year. Although Pfizer has come up to say that you may even need a 3rd dose as a booster after 6 months. Because the body, after a certain period, will lose that amount of antibody. And then you need another challenge for you to mount a stronger response and for it to last even longer. So yes, you will need a booster. It's a question of duration and depending on one vaccine to the other.
All right, there are numbers of people keep asking on the jab more than one brand of vaccine, which has been answered earlier, but I suppose there are some newcomers. They ask, can I, like, Huimeng, can I take other brand vaccine after 2 doses of the same brand? And Meredith, can you jab more than one brand of vaccines? And oh yeah, this question may be why people who are diagnosed with COVID positive need to be vaccinated again after 3 months. Maybe Dr. Koo, are you able to answer these questions?
Okay, generally, if you say, I'll answer the first one first, whether you're able to take different brands. The thing really is, if you have been vaccinated and you have not mounted an immune response, then certainly getting a booster from any brand is probably acceptable. They have this concept of heterologous, meaning you mix vaccines. I mean, some countries are already doing that. And I believe it will come to that because it also has got to do with availability of particular brand as well, in addition to responsiveness towards a certain variant. So yes, that is acceptable and will be done. Now, as to why you need vaccination after having COVID. Now, we know that once a person has COVID, they will develop a certain amount of immune response as well. But again, this is uncertain because like we know, some COVID infection or majority of COVID infections are asymptomatic. We do not know whether the body has mounted enough immune response. Whereas in the vaccination process, we give a standardized amount of be it viral factor or be it mRNA or be it a protein subunit to stimulate the response. So this is a more controlled situation as compared to a native infection. So yes, traditionally we say we wait 3 months, but even now in the vaccination centers, we are also allowed to give even after a short period of infection, not necessarily after 3 months.
All right. And any other thing to add on, Dr. Tan or Dr. Marilyn? On numbers?
Basically, I think, yeah, I mean, in the end, it all comes down to, as we mentioned, keep mentioning about these neutralizing antibodies. If you were to be infected with COVID-19 virus, your body is able to mount an immune response and produce a lot of antibodies against the virus. But those antibodies that's produced, majority of them are irrelevant when it comes to offering you future immunity against this virus. What is important is the antibodies against the spike protein of the virus. So with immunization, you are actually training your body to be more focused, to be more precise when it comes to conferring an immunity against the virus, as opposed to the virus itself. So this is reason why people who had COVID-19, they can still be reinfected. And that's why these patients still require immunization.
All right, I think Kim rephrase the questions for me. Is there a risk that the long-term COVID side effect may pop up sometime after vaccination? If one does not have any adverse side effect after the first 2 jabs, Would it be long time after? Would it be any side effects, or as long as you feel a certain time after, there won't be anything? Any of you can answer this?
I think there shouldn't be any.
Yep.
If you are okay and after a certain period of observation, you don't have side effects, there's no reason why you should suddenly develop an allergy or bad side effects long after that vaccination process.
Should not be, right? Okay, Suhan, you asked a question that's been answered. Need to the next vaccination after the initial 2 jabs. You are talking about the third. Oh yeah, I think he's talking about the third. After 2 jabs, many of them consider completed the vaccination process, but there are people talking about third or even more jabs a year after or a year after. Would it be the case? Any idea or any confirmation that you need to, after 2 jabs, do you need to have the third or a second time, or but in any condition you need to go to?
I think again comes down to the neutralizing antibodies. This is something that people are looking at in the future as to whether or not you need the third injection. By looking at the neutralizing, it's a bit like the hepatitis B vaccine. So when you're vaccinated against hepatitis B, you can do a blood test to see how well your immunity is against hepatitis B. If it's low or below a certain level, then you need a booster dose. If your antibodies is above the certain level, then you don't need to have a booster dose. So I suspect this will be the case for COVID, that people are able to do a blood test to see how well they are immune against the COVID-19. And if their immunity falls below certain level, I think something like 30%, then they will probably need a booster dose. But if their immunity is above 30% or 60% above, then they may not need a booster dose. So this is something in the future, but I think people are still looking into this area at the moment.
Now, Dr. Marilyn, can I ask you, a number of them say that even being vaccinated, and some reports show that also can be possible getting COVID again. The question is, if that is the point, why you need to get vaccinated, as you may still get you may still get COVID. Is it true?
Yes, true. So like as I answered earlier, giving you the Singapore example,
right.
If you do get it the second time around, though, it will be possibly more muted disease, less severe disease, and maybe you won't even need to go to the hospital as compared to getting a case for the first time, and you probably have oxygenation and ICU admission and death.
That's yours. All right.
Dr. Sri, can I add a little comment on this? I think the vaccination process is really a public health measure, because the only way we can take this pandemic away from our lives is to prevent the transmission. And the whole idea of vaccination is to cut this transmission chain. Because if you reduce the number of infections going on in the community, then it will not be transmitted from one to the other. So vaccination, remember, is not just for the individual, it's also to protect the community. Right. Yeah, I think that's something that people have to remember. It's not just about you, it's about the community that they live in. And vaccination is truly for us to get that herd immunity, where about 70% of us being vaccinated, therefore the virus cannot be passed from one to the other easily. And therefore we cut off the chain of transmission.
All right, thank you, Dr. Koo. And that's the questions, and I think we also have the slide for this one. They said that I have a high blood pressure and diabetes, and I was advised by my family not to take the vaccine due to blood clotting risk. Maybe Dr. Marilyn, can you give us some advice on this blood clots? And then with these people have high blood, so-called high blood pressure, diabetes, do you advise them to do so? And I will put up the slide in a minute,
Yeah, sure. So without a doubt, yes, my answer is a resounding yes. You have to get yourself vaccinated, even more when you have a chronic disease, simply because your immune system is deemed to be lower if you have diabetes especially. And this issue about blood clots is very different from the blood clots that is caused by, plaques from cholesterol or inflammation that comes from diabetes. These blood clots that may come from the vaccine is actually due to an immune process. So a lot of patients, when they hear the word blood clots, they immediately think it's got to do with their heart attack and their previous stroke and they're at higher risk. So we are here just to show in this slide that potentially if you get COVID, the risk of ICU admission and blood clot is even much more higher than getting a blood clot through the vaccine. So it's still overall more benefit than harm, and all the working papers have shown so far to please go ahead and vaccinate. Yeah, this is another slide that very clearly shows the vaccine, which is linked with the immune clots as compared to normal things like a birth control pill or even smoking. We don't think twice about this, but then you're having so much discussion when it comes to the vaccine. So it's still the main take-home message is to go ahead and vaccinate. Yes.
Yes, thank you, Doctor. Now, back to these questions. We are rushing for time, but Dr. Khoo, I have some questions on this. Can someone who has COVID and needs a heart surgery? We know Dr. Khoo is a heart specialist, and can they have operation even during the time they may have COVID? Dr. Khoo?
So let's look at the general situation where whether can a COVID patient safely undergo an operation. Now, generally, once a person recovers from COVID completely, we know for a fact that this inflammation will goes on for a while. So generally, if the operation can be delayed, especially like it's a major operation, like a bypass operation, for example, we like to possibly delay it up to even 8 weeks before we do the heart surgery, for the fact that we want the inflammation to settle. But if the operation needs to be done emergently, certainly we will go ahead and operate anyhow. Of course, with a higher risk, of even risk of death in that person. We found that if a person undergoes heart surgery and the person just had COVID, then the risk is almost about 3 to 4-fold of that compared to a normal person. So we tend to wait for about 8 weeks before we do the operation.
All right, good questions. I think that answered the questions. Well, come to the end, we want to talk a little bit about public. And here we want to know that how do you advise the general public to do in order to so-called jaga semua to take care of the whole society and to get ourselves out from this pandemic? Maybe Dr. Ten can let me know any advice to the general public. What should they do, to prevent from public or families or friends to get infected?
Yeah, I think it all boils down to social distancing and also get yourself vaccinated. That's what Dr. Marilyn has just emphasized earlier on. So social distancing, get yourself vaccinated, and also make sure to minimize the amount of work that you have to do in office, so you can work from home as much as possible. And if you do have to go to office to work, then you have to ensure the ventilation is sufficient. A lot of offices, the aircon system, they are all internally circulated. There's no fresh air coming in. So either you have an exhaust fan, or if not, then if your building allows you to open up the window to ensure the ventilation is sufficient, and also to ensure that every single staff are as far away as from one another as much as possible. So I think these are the things that one has to, to ensure to keep yourself safe, and also to the population as well.
Yes, I think we have prepared a slide. Maybe for Dr. Marilyn can further explain on, any other advice other than the list, or can you explain a little bit on that? Also, what is your idea? What is your comment?
Maybe I'll just talk about the point number 1, self-imposed lockdown. And there you see the term social bubble. So Dr. Sri, I think if you go to the next slide, I can explain what is a social bubble. It's a bit of a fad term now that's been used in the Western countries. But what this means is that you have to create a group, a very exclusive group. And in this group, it will only contain the same number of people and the same people. And you will not let anyone new into this group. So Once you're exclusive to this group, then you can mutually mingle. But for now, under our strict MCO, your first bubble, of course, will be your household. So I always like to make this definition very clear. Family, even though your family does not live with you, then they are not part of your household. Household is the people you eat with in the same house and the people who, you finally stay and live with 24 hours. So if you have parents, grandparents, even though, yes, they are your family, but they are not part of your household. So stay with that bubble. And if you are in the essential service, then your colleagues at work also become a second bubble. So you can move freely between these two bubbles. Yeah. For example, the yellow circle here in the middle is a gentleman with a very small family. But just because he meets one person around him, in his sports or relatives or in social meetings, he doesn't realize his bubble is actually 100, 200 plus people, thinking it's only 4 people. So this is how we expose ourselves to the virus. And now with variants, we don't need to spend, a long time, just 15 minutes, even with mask, you can be a potential close contact. So just remember that the only bubble you have is your household. And if you are part of essential service, then your colleagues at work. So that's how we move very freely between these two bubbles, yes.
So I heard today from the news, I think for parents, even you have your mask on and just cross bypassing you, also possible to be, to be infected. Is it true? So scary.
For now, the definition of close contact is 15 minutes with mask on, less than 1 meter apart. So if you think carefully, it probably happens in the office space or in the grocery store if the queue is very crowded. So be very aware of your space that you go into. Make sure, like Dr. Tan mentioned, it's a well-ventilated space. But by definition, close contact is still less than 1 meter, 15 minutes, longer than 15 minutes, yes.
Okay, here are some questions that I'd like to read through first. Roger Young says, should I buy insurance for COVID when majority cases of COVID are being treated in government hospitals? What if there are no more ICU facility available even in all the private hospitals? Does it matter if you buy insurance, there is no more bed, so-called ICU facility? I don't know any of you want to answer this question. So is there any insurance for buying for no ICU facilities? Or I understand it's very expensive to go to private hospital, by the way. Is it true?
Currently, the insurance does not cover COVID, if I'm not wrong. Whether there are any new insurance that just came out that just specifically cover for COVID, I'm not sure. I'm not an insurance expert. I don't know about the rest.
Any answer? No more, right? Okay, let's see the next questions. Somebody is pregnant, planning to have a baby. Is it encouraged to be vaccinated? Pregnant? I think I saw the news that they cancel, right? But also I saw a sad news as well earlier.
Yeah, I think if you declare to the healthcare practitioner, they will verify what type of vaccine. But if you're planning for a pregnancy, yes, vaccination is not contraindicated.
Mm-hmm. All right.
And I think right now, if I can add, I think right now Pfizer is safe for pregnant patients. Whereas for Sinovac, no studies for that. Sure. So for now, in this country, yes, Pfizer is given for those who are currently pregnant.
All right. My advice to you is to get doctor to advise you. That's simple, right? Okay. Agnes Tan has the same questions I have. I just have my dentist have a treatment on my root canal. He asked, can I continue with that? Because there are some so-called maybe fake news spread around that you should not get treatments on this and that. So can I continue with my root canal treatment 1 week after my second dose? There's no dentist here, but any of you can answer this?
I think
it's more afraid than a patient.
Yes,
treat any operation. If it need to be done, then need to be done, and there's no contraindication towards that.
And then Chia, children vaccination below 18 years old, any comment? Because this is here and there some study about young age vaccination. Do y'all recommend or comment anything on the age of below 18?
I think the pediatricians will be coming up soon with a talk. If I'm not mistaken, there's one early July. So let's see what their stand is on less than 18 years old. Yeah.
Yes, dear Kelly has given some comments. Say currently only AIA Medical is covered for COVID treatment admitted to private hospital, fully covered based on reimbursement basics. Thank you, Kelly, for this information. Now, would also like to advise that social bubbles we talk about. Now, there are news come out with double masking, right? Maybe double mask. Maybe Dr. Meredith, can you? I think I put a slide here also. Is it necessary?
Yes, I personally think so. And I think Dr. Fossey from CDC, from the White House, has also started double masking. So there was a study that was done in the US, and they realized that as the variance has increased, the virus has upgraded. So I think we should upgrade our mask as well. And the analogy behind this is, I think in the next slide, if you see surgical mask only confers about 50% protection. And then cloth masks are also very popular. That's another 50%. But if you wear the surgical mask with the cloth mask on top, then you actually increase your protection to about 85%. So with that, we now have we have encouraged double masking if it's in your means. But this doesn't apply if you already have an N95 or a KN95 or a KF94. All those are superior to double masking. But a surgical mask and a cloth mask alone may seem a bit risky in this time of variants. So do step up and double mask, yes.
Before we end this session, I'd like three doctors to share with us on some further advice or any forecasts or predictions about COVID, about vaccination as a conclusion, so-called the ending. Can we get some advice from Dr. Tan first?
Prediction.
Yeah, and any prediction advice.
I just believe that COVID-19 is going to be around. It's going to stay with us. It's not going to totally disappear. It will end up going to be like influenza virus, where it will become seasonal, and from time to time there will be new mutation, new strains coming up. So we're potentially seeing some hybrid of strains. Now that people in Vietnam, they talk about a combination of the UK and the Indian strain, recombinant. And perhaps maybe things like after Delta strain, probably see an Epsilon strain coming up in the future. So we don't know. But we just hope that we're able to control this to such a level that allow us to live as normal life as possible. But people have been using the term as normal, so it'll be a new norm.
Yeah, normal is my dream. It's so simple dream.
I want new normal
only. That never happened in the history. Yeah. Dr. Marilyn, anything else you need to talk to our audience or our friends here?
Yeah, I think as we can see today that the immune system is not just dependent on the vaccination to fight COVID. I think overall, let's not forget our physical health, our mental health. I think in times of MCO, maybe, we are not so much stuck in a jam and not out of the home. Do invest in your health, do your regular blood works and physical exercise. I am always a big fan of that. And eat clean, eat healthy. Do try to incorporate some new and permanent lifestyle changes. So don't forget that part of your health spectrum as well.
That's a good advice. I know a lot of things are free, the sunlight and nice, good air, clean air, but we are always a bit lazy, exercise, all that kind of thing. Thanks for the good advice from Dr. Marilyn. And then Dr. David Khoo, can we have your advice as well?
So for me, this pandemic is truly a depressing thing, but I think we have to take heart. Yeah, take heart that there is a way out. And truly the way out, truly for now, is the vaccination. I think this is very important that we realize that this vaccination is just not only for ourselves, but it's also to protect the society at large. So when there's a chance to be vaccinated, please do attend, and encourage those who are against it to learn more about it, not to be too unnecessarily afraid, and go forth and get yourself vaccinated.
All right, good say. Thank you so much for our three doctors. And the most, of course, thanks for the audience and fantastic three doctors, which is quite difficult to put them together for today's sessions. And I need to say thousand. No, thank you again and again and again for Dr. Tan, Dr. Marilyn, and Dr. David Khoo. Thank you so much, ladies and gentlemen. Have a good night. Thank you.